I think the whole issue of universal health coverage is a good concept. It's an access issue, it's an equity issue, it's a right issue. Because people have the right to access health care regardless of their level of economic development. If you look at the health systems, to actually ensure that that concept becomes a reality, then there's a need for integrated approach of the health systems. And we can talk of the formal health systems, the informal health systems, including the community health systems. There's a need to integrate all of them together because within those systems, people have preferences for accessing healthcare. I do believe very strongly that the informal healthcare providers have significant role to play if the universal health coverage is to become a reality. And within this particular argument, the government has strategic role, first and foremost in ensuring that it has a change in its policy to embrace universal health coverage as a policy. I think the second thing that is of import is that the government should be able to now come to a situation of addressing the issue of informal health providers by ensuring that the gaps in competent practices are addressed, gaps of knowledge are addressed probably by training, by accreditation, and of course by branding the informal providers who actually should have met certain criteria to become competent practitioners embraced by the government. Beyond that, I also believe that the government has a unique role of providing public health or medical products at low cost to the informal providers. And I think that's very significant. Let me use the illustrative example in Nigeria, where the government, within the malaria program, was putting on this program of community integrated malaria with the private sector and the public sector. And one thing about it is that the ACTs are expected to also be delivered to the informal sector of the PMVs at very low cost through that particular program. That's an example in which you ensure access of poor people to quality medicines at affordable prices. And the last thing I want to talk about has to do with, yes, once that is going on, the government also needs to ensure that, yes, it brought in a lot of partners in order to deal with this particular problem. It's not a thing the government would like to solve alone, but a lot of partners have to be rolled in. And the program has to be evaluated over time so that we can learn lessons in terms of what works well, what gaps need to be addressed. And I think that once we do that, and there's a network of these informal providers that could actually drive the universal access program into reality.